the Centers for Medicare and Medicaid Services Center for Clinical Standards and Quality brings you CMS QI Voices, an audio series that gives you a closer look at the projects and people who are improving healthcare quality and outcomes. These brief conversations include detailed show notes for even more insights into the process behind healthcare quality improvement and how you might adapt these to your own organization. In this series, CMS explores how nursing homes and Quality Innovation Network quality improvement organizations have worked together to tackle challenges related to COVID-19 vaccination, infection control, and the use of therapeutics to improve resident outcomes. Let's listen in.
Welcome to CMS QI Voices, Improving COVID-19 Outcomes in America's Nursing Homes. I'm Dr. Paul Rosen, Medical Officer at the Center for Clinical Standards and Quality at the Centers for Medicare and Medicaid Services. Today, I'm joined by Deb Arbogast at Medicine Wheel Village in Eagle Butte, South Dakota, and Carrie McDermott at Great Plains Quality Innovation Network in Lincoln, Nebraska. In today's episode, we will be talking about using a culturally inclusive approach to increase vaccine confidence and address potential health disparities to increase resident COVID-19 booster rates. Welcome. Thank you both for being here. Deb, can you tell us about your facility and the population you serve?
Yes, Medicine Wheel Village is a nursing facility on the Cheyenne River Sioux Reservation, located in Eagle Butte, South Dakota. We work with Native American residents in our nursing facility.
Carrie, can you describe the resources you provided to help Medicine Wheel Village support a culturally inclusive approach to building vaccine confidence among their residents?
Absolutely. As the quality improvement organization for North and South Dakota, we pride ourselves on being a resource and a go-to partner for healthcare organizations in our region. And when we first began working with Medicine Wheel Village to assist them with their vaccination efforts, they had already scheduled a vaccination booster clinic for their staff and residents. So at this time, our primary goal was to establish a relationship with their team, knowing that they could trust us and respect us. And then we worked to identify ways we could support their efforts and their team in a meaningful way. We wanted them to see us as a quality improvement partner. We made sure their team was aware of and took advantage of educational offerings, resources, and ways they could get connected with other nursing homes in the Dakotas, as well as to members of our team. We hosted a motivational interviewing webinar, which members of their team attended. And as a follow-up, we shared motivational interviewing tip sheets and additional resources to help with vaccine hesitancy among their residents and community. We also developed a few nursing home specific resources, a COVID-19 vaccination change package, a COVID-19 key resources document, as well as a handout on tips for reaching disparate populations.
Deb, which of these tools was most helpful to your efforts, and how did you apply it to your work?
For us at Medicine Wheel Village, being a standalone nursing facility in a remote area, our team was very grateful for the online education that they provided and the flexibility with that education and follow up, whether it be email or phone calls, if we had any questions. So for our facility to be able to have the quality education piece for our team and the flexibility to attend the follow-up training from those online quality calls was probably one of the key factors that assisted us in our vaccination rates.
Carrie, can you describe the educational resources that you offer to all nursing homes in your region, such as your weekly Boost webinar series and your nursing home listserv?
I sure can. As Deb just alluded to, Great Plains Quinn hosts a weekly Boost webinar series for nursing homes in the Dakotas. Those are held on Thursdays at 4 o'clock Central Time. And each week, our team of quality improvement experts cover a topic related to COVID-19 boosters and vaccinations. These booth sessions also include an office hours segment where participants can ask questions of our team, share concerns, and offer solutions in a safe environment. Deb and her team attend our booth sessions regularly, and each week we update the COVID-19 booth resource list with tools and resources shared at each session with all attendees. You also mentioned our listserv. We do host a nursing home listserv. We have about 700 nursing home members participating. The listserv is a two-way communication platform for our team and nursing home members to ask questions, share resources, and evidence-based tools. It's also a vehicle for Great Plains Quinn to disseminate and share information, updates, and guidance quickly. The listserv conversation is very active, and I'll add that Deb is an asset to listserv participants as she frequently offers responses and answers questions raised by other members.
Deb, how would you describe the value of working with Great Plains Quinn to improve your resident COVID-19 booster rate?
One of the main things is the education and the knowledge that we have obtained from them, but also, they were always available to us as a sounding board if we ever had any questions on any new information coming out. And that, kind of just goes right in line with our values here at Medicine-Will Village, with knowledge and sharing that knowledge, instilling trust then with your employees and your residents.
Before we close, what's one thing you'd like our listeners in skilled nursing facilities to know as they go back to work in their facility? Deb, why don't we start with you?
One thing here at Medicine-Will Village that we feel we are very successful with our vaccination rate is we looked at making sure we had easy access for the vaccine for our employees and elders. We looked at respect for our family and community with receiving the vaccination. We looked at the education, communication of that education to our employees, residents, and their families. And we also looked at generosity, which is one value with the Lakota. And that is where we did offer a financial bonus for our vaccination rates for all of our employees.
And Carrie, what's the one thing you'd like our listeners to take away from today's conversation?
Well, we applaud the team at Medicine-Will Village. They've done an exceptional job of offering vaccine-related education, answering questions, and serving as that trusted resource among their staff, their family members, and their residents. We will continue to provide education and technical assistance as the Quinn QIO to support them in all areas of their work and their quality improvement efforts, as the partnership with Medicine-Will Village has been a valuable one for our team.
To our listeners, thank you for joining. Be sure to join us next time to hear more impactful interventions for increasing vaccination rates and reducing mortality in nursing homes.
To learn more about today's episode and to access all of the CMS QI Voices audio series and show notes, please visit qioprogram.org/CMS QI Voices. Thank you for listening to CMS QI Voices.